So, so we will start the introduction from the right side here. And please, again, just mention your name, your institution, and the role you play in the State of the program. Thank you.
Okay. My name is Blessing Amaike, Babcock University Teaching Hospital Pharmacy Department, AMS committee member, and then SFM champion.
Good morning all. My name is Yakubu James. I work for the Federal Ministry of Health. I'm also a national mechanism oversight mechanism member. Thank you.
My name is Vivian Chukwu. I'm a pharmacist, AMS committee member, Local University Hospital, NAFA fellow, and I'm here as a mentor for the present set.
Okay. Good morning. Fidelis Ewa Uwoma is my name. University of Nigeria Teaching Hospital, Enugu. I'm an Alpha fellow already, the ones that graduated last year, and I am here as a mentor and a team member from UNTH. Thank you.
Good morning, everyone. My name is Shukura Uju. My institution is University of Nigeria Teaching Hospital, Itukozara, Enugu State. Okay, I'm an SF champion.
Good morning, everyone. My name is Moralu Genevieve. I work at National Orthopedic Hospital, Enugu, and I'm a UK-ALF-A fellow. Good morning, everybody. My name is Ifoma Julia Obi. I'm from Lagos University Teaching Hospital, and I'm also a UK-ALF-A fellow and an antimicrobial stewardship committee member. Thank you.
Okay. Good morning, everyone. I am Olajide Abimbola. I'm from Babcock University Teaching Hospital, and I'm a UK-ALF-A fellow. Thank you.
Good morning, everyone. My name is Emmanuel Obasi. I'm a UK-ALF-A fellow for the University of Calabar Teaching Hospital.
Good morning, everyone. My name is Olami Kayobari Victor from the University College Hospital, Ibadan. I'm a UK-ALF-A fellow. Thank you.
Good morning, everyone. I'm Olubukola Kalijai from the University College Hospital, Ibadan. I'm a substandard and falsified medicines champion. Thank you.
Good morning, everyone. I'm Yinka Deyemi. An Alpha fellow, not a UK-ALF-A fellow. An original Alpha fellow. And a community champion for Nigeria, and also a mentor for CPA. Thank you.
Thank you. Good morning, everyone. I'm Kayode Odoayo from University College Hospital, AMS committee member, and basically I'm involved with data management on antimicrobial consumption surveillance in the hospital. Thank you.
Okay, good morning, everyone. Udune is my name. I'm from Babcock University. Thank you.
Good morning, all. My name is Mampoli Saru. I write for the Punch newspapers.
Good morning, everybody. My name is Babatunde Ogobashi. I'm a paid side specialist at the UCH Ibadan. I'm the LMIC for the Ibadan Sheffield Partnership. Thank you.
Good morning, everybody. My name is Ibikule Oluwadamilola. I am from Lagos University Teaching Hospital, and I am part of the AMS committee.
Good morning. Oyeduyebo, consultant clinical microbiologist and the chairman, antimicrobial stewardship committee, LUTH. Thank you.
Good morning, everyone. My name is Dr. Odunuga Patricia, Director of Pharmaceutical Services, Lagos State University Teaching Hospital. I'm a substandard and falsified medicine champion. Thank you.
Good morning, everyone. My name is Professor Ibrahim Adekunle Oreagba, Supervisor to Medical Clinics. Thank you.
Good morning, everyone. I'm blessing for the Babcock University Teaching Hospital AMS Committee member. Good morning, everyone. I'm blessing for the Pharmacists from Babcock University Teaching Hospital AMS Committee member.
Good morning, everybody. My name is Fumi Ogundare. I write for this day newspaper.
Good morning. My name is Josephine Akare. I work with Babcock University Communication, Media and Branding Departments. Thank you.
I'm Charles Eliku. I'm the LMIC lead, Babcock University.
So thank you, everyone.
You have introduced me now. I am Pharmacist Ayubatanku Ibrahim, President of Pharmaceutical Society of Nigeria.
Good morning. I'm Mr. Ognola Adenike. I'm representing the Registrar of Pharmacy Council of Nigeria. Thank you.
We'd like to call the CMD of the Babcock University Teaching Hospital, who is the chairman of this occasion, to come right to my frontier with due respect, sir. To join him is our chief host, the LNIC lead for BOA, Professor Charles John Eliku. You know, as a pharmacist, when I get to this hospital, I will not go to Professor Charles' office first. I will go to the office of the Director of Pharmacy. So, in that respect, with the permission of the CMD, I want to invite Mrs. Blessing Aike to join the activity. This activity will be complete. I can be scattered by just a letter, a forward sentence for someone here. And that is the representative of the Ministry of the Federal Ministry of Health and Social Welfare. Pharmacist James Yakubu. So that's done. Thank God we are all Nigerians. We have missed one very important thing, but it's never too late. Please, can we rise for the national anthem? Someone who has a good voice lead us, I will make us. So can someone lead us? I don't have a good voice, but if you want, I will do. 1, 2, 3. Nigeria, waiting. Yeah, fly. No time on me, stand. Nigeria's all I want to see. Amen. That's beautiful. This is to hear the national anthem. And then we answer our prayer. One person, people are supposed to be here today, they are not here. Due to circumstances beyond their control, where we bought his ticket only to inform us 48 hours ago, or 36 hours ago, that due to office exigency, he will not be able to come. That's Dr. Ridwan Yaya, who has been with us right from the beginning of this program. He's the AMRGS officer in Nigeria. He's also the AMS focal point for the country. The other fellow who everybody also knows very well is Pharmacist Sterling, by the way. Unfortunately, I could not even buy a ticket because there was no money. But at the point of buying a ticket, her father fell sick, and she is currently on admission in Abuja. We pray for a quick recovery for the father and joy in that family. Thank you. So, that done. Yes, welcome remarks by me again. Don't be tired of me. I just find myself to be the only one here. So I have to play so many roles. The CPA, that is a Commonwealth Partnership for Antimicrobial Stewardship Program. It's not strange to everyone of us here. And before I say anything, I want to sincerely, on behalf of all the participating teams and their institution, thank the Pharmaceutical Society of Nigeria for enrolling the nation on this program. The gains we have attained is tremendous. And it is our hope that the society, the president promised me yesterday, that it is PSN will continue to pay its dues, play its role in the CPE, so that the nation does not lose out in the benefits of being a member of that eminent association. I told him what we gained physically, and I told him what we gained that is beyond estimation in terms of naira and couple of pounds and sterling. So again, Mr. President, on behalf of the whole team, we are sincerely grateful for the opportunity. The CW-PAM program was designed by the CPA, supported by the Global Health Partnership, to address the issue of microbial resistance, with focus on empowering pharmacists to contribute meaningfully to the healthcare system through the AMS platform. And the program is funded by the Fleming Fund. Funded through the Fleming Fund by the British Department of Health and Social Care. It's been very, very impactful. It started in 2019. Nigeria joined in 2021, with Luth being the first participating team. In 2022 or 2023, about 4 institutions joined. At phase 2, we had phase 2 concluded in 2025, 24, and then 2025 was for an extension of phase 2, which we call 2.5. So many activities were carried out there. The institutions can attest to that. To perform the AMS activities within those institutions. The gain has been very, very tremendous. If anybody asks me what is the main gain, I will tell you the main gain is that it has told us the benefit of working together as a team in the healthcare sector. It clearly demonstrated that nobody can clap with one hand. The cleaner, Bangkok University Teaching Hospital, I want to refer to your behavioral change program. The cleaner was made to understand that he or she was as important as the CMD to the survival or the successful outcome of healthcare in this institution. So everybody was made to understand. Respects the practitioners, healthcare workers begin to respect themselves, realizing the contributions each category of healthcare workers could make to his or her own role in the system. So as far as I'm concerned, that was the key thing. And it also brought out some gaps in the nation. I told you when we started, it was only you to that join. Why? Because to you to join, you must form an MOU with a foreign, a UK-based institution. Most of our institutions could not do that because they had no existing collaborative arrangement with them. We have it means our institutions, our universities have been working alone. And according to Liverpool Football Club, that shall not work alone. And according to the Yorubas, it's because the snakes work in singles. That's why there is snaking. So I want to implore these institutions, I've told them the 5 institutions, to take the MOU beyond the AMS. It should be made an institutionality. And I hope it will be reflected in our institutions. We need to collaborate with other centers in the group to do their work. So, in order not to take your time, we all know for sitting down here, as I said, we are no strangers, except the placement to the CW program. So we are here today to do the concluding part of the program. It's concluding part because the British government, through presidential order of DT, Donald Trump has stopped funding the program because they have been told to defend themselves. So the money for well-being has been told to provide missiles. So we hope they will not replace work classification with nuclear bombs for us to treat patients. So we are here today to do the complete part, the graduation ceremony of the UK-ALF-A fellows. This set of people, you will hear later, they've gone through tremendous training. One of them, in fact, not one of them, because I created the platform for them, and I could see what it took them to go through the program. But at the end of the day, we give glory to God, as we say in Nigeria. They all made it. So congratulations to all of you. So that's what we have to do. So please, if you look at our agenda, the next thing is high-level remarks. And we'll be taking the first remark from the PCN. There is the Pharmacy Council of Nigeria. Yes, ma'am. You don't clap well, your license will not come out.
Thank you so much. President, sir, the CMD Bangkok, my Oga at the top, Pharmacist Lama. I recognize my actually I did my internship on that. So it's a blessing. So let me stand on the existing protocol, please. The registrar will have wished to be here, but due to his tight and very important assignment, that's why he could not make it. I'm Pharmacist Mrs. Ogunlola Adenike, the Southwest Zonal Director based in Ibadan. So he has dedicated me to represent him. So I'm going to read the remark from him. Remark by the Registrar, Pharmacy Council of Nigeria, from Ibrahim Babashiru Ahmed, FPSN, FPC Farm, FNA Farm, FCAI, on the occasion of Commonwealth Partnership for Antimicrobial Stewardship Impact Celebration and UK-Africa Fellowship Graduation at Bangkok University, Elisha Remo, Ogun State, on March 4th, 2026. It is my pleasure to join you on the occasion of this Commonwealth Partnership for Antimicrobial Stewardship Impact Celebration and the UK-Africa Fellowship Graduation Ceremony hosted by the Commonwealth Pharmacists Association. This event is more than a ceremony. It is a testament to what we can achieve when nations, institutions, and professionals unite around a shared public health mission. Antimicrobial resistance remains one of the most pressing global health challenges of our generation. It threatens patient safety, food security, economic stability, and the sustainability of our health system. No country is immune, and no single institution can solve it alone. That is why Commonwealth collaboration is so vital. It brings together diverse health systems, regulatory authorities, academic institutions, and frontline practitioners under a shared commitment to safeguard the effectiveness of antimicrobials. Pharmacists stand at the heart of the response to antimicrobial resistance. We are stewards of medicines, guardians of safe supply chains, and trusted advisors to patients and communities. PCN, Pharmacy Council of Nigeria, regulatory frameworks does not only ensure quality, safety, and efficacy, but also actively promotes responsible antimicrobial use, strengthens surveillance, and supports innovation in practice. Pharmacy Council of Nigeria newly enacted laws sit at a critical intersection where science meets policy, where evidence informs standards, and where oversight safeguards both access and quality. Pharmacy Council of Nigeria establishes the standard for responsible prescribing and dispensing. It strengthens pharmacovigilance. It supports the fight against substandard and falsified medicines. And it creates an enabling environment in which pharmacists can practice ethically and at the highest level of competence. Stewardship is not only a clinical responsibility, it is a regulatory imperative. I'm sorry. I commend the Commonwealth Pharmacists Association for its vision in nurturing leadership that directly contribute to the global fight against antimicrobial resistance and their commitment to strengthening antimicrobial stewardship through partnership and professional development. The Commonwealth, with its diversity of health system and shared professional value, offers a powerful platform for collaboration. Through partnership, we exchange knowledge, harmonize approaches, strengthen capacity, and build trust. It demonstrates that when we combine regulatory strengths, professional leadership, and cross-border collaboration, we can achieve measurable impact. This collective effort is essential if we are to preserve the effectiveness of antimicrobials for future generations. The fellows we are honoring today have demonstrated commitment, resilience, and vision to research, stewardship initiatives, policy engagement, and community outreach. They have translated knowledge into measurable impact. They are not only participants in the fight against antimicrobial resistance, they are catalysts for change within their institutions and cross borders. To our graduating fellows, your achievement today marks the beginning of an even greater responsibility. You are now ambassadors of antimicrobial stewardship and champions of quality use of medicine. Your fellowship may conclude today, but your journey does not end here. Your networks, the networks you have built, the expertise you have gained, and the vision you carry forward will shape pharmacy practice and stewardship efforts for years to come. We count on you to lead with integrity, to advocate for evidence-based policy, and to inspire the next generation of pharmacists and healthcare professionals. The responsibility is great, so also is the opportunity. Congratulations to our fellows, to all our fellows. Thank you for to our partners, and let us continue this vital work together. Thank you. God bless.
Then he told me to come and beg her. So thank you. Before we proceed to the next one, we will set the rules. Please encourage everybody to be safe now. But to be safe, we have been told that that's why we came here. So you are safe. Then feel free to ask questions. We shall be taking pictures. We assume that you agree that you should take your picture. We are not using it for commercial purposes, but just to promote the program which you are fully a part of. We encourage everybody to put his or her set on silence mode. And we have breaks, tea breaks, and of it we have lunch. And for those who want to collect money from me, please submit your receipts. That's a list there for you to sign. Not one receipts. I'm signing the answer pocket. Please agree that you took that before you go. And if there's need for you to go to London, it's as soon as you land that ferry day in your station. Do it. Because I have deadline. I've managed lots of work to round up everything. So the next person, the big one, is Pharmacist James, representing the Federal Ministry of Health.
Okay, sir. Remarks without surprise, high-level remarks. That's a little bit on my side, but let me start by recognizing my president, the president of the Pharmaceutical Society of Nigeria, Pharmacist Ibrahim Tanko, very humble gentleman, as you all know. It's a pleasure to be with you on this table today. And of course, any pharmacist seated here who was hesitant to clap knows that he or her certificate would have been on the line, not to welcome the. I don't want my own license to be on the line now. So I also wish to really, really recognize you and the beautiful speech that you have rendered here. And of course, our host, the CMB. So what a pleasure to meet you. My Uga over there, the head of LMICU, Babcock University. And incidentally, you know, the head of department of pharmacy at Babcock University Hospital, pharmacist blazing. This is not working. Hello. Okay. The pharmacist blazing. Who is my classmate? You know. And I didn't know that. So I had that very high level of, you know, management and once again. I'd like to also really recognize two people. The gentleman here, I didn't even know they were seated, but who are very, very immense in the field of antimicrobial stewardship. Their contribution is so huge and immense that you just need to know what they are doing to appreciate, you know, the impacts that they have also made and continue to make in the field of, and I'm talking about Professor Udebo, and of course, Professor Udebo, thank you. Yeah, so let me from the onset just categorically say congratulations to our graduates, the ALF-A graduates, This is a remarkable feat in antimicrobial stewardship that you have reached. It's a milestone. I want you to carry this momentum of this occasion from operating at your base, which is the hope of antimicrobial stewardship, to multiple other hopes and possibly multiple other spores and centers of antimicrobial stewardship across this country, or at least within the vicinity of your healthcare facility. That is the ultimate objective. We are seriously behind when it comes to the implementation of antimicrobial stewardship programs in this country. A lot of countries much smaller than Nigeria have gone a little bit ahead of us. I think we need to really go to catching up and bring it with the speed of light if possible. And so I encourage us to take this as more of a task responsibility rather than just carrying the program of that is Alpha Fellow, UK-ALF-A Fellows. It is not the program, it is actually the responsibility that comes with it. That is key, and that is most important. So I congratulate you and wish you the very best as you propagate the antimicrobial stewardship message of this facility and the country at large. I want to point out that as a Federal Ministry of Health, our responsibility is clear and well cut out for us to provide policy direction for antimicrobial resistance program. And that we continue to do, especially as pharmacists embedded in the Department of Food and Drug Services. We will continue to support antimicrobial stewardship programs by providing the requisite policy direction that provide clarity as to what we need to do, when we need to do, and how we want to do it. We are determined, and that's why you see that we continue to review government policies, including the National Drug Policy, which is an omnibus overarching drug policy of government in this country. We are also very apt and very up to date with the essential medicines list, both for adult and for children. And if you've had the opportunity of either downloading or having the hard copy of the most recent and the current essential medicine list, you would have seen that there is an improvement on that document, in that it now has incorporated in it the aware categorization of antibiotics, and that was done. Yeah, I think that deserves a round of applause. That you should feel absolutely free to do that. Yeah, that was work that was undertaken by the Ministry of Health, using consultant, including Professor Gumbosi, who helped us, with some of the, studies to inform the categorization of antibiotics. So that's a huge one. Of course, the standard treatment guideline is a very, very important document if you were to ensure, stewardship of antimicrobials in Nigeria, and that's also a document that is developed by the Food and Drug Services Department, and will continue to do that. As a matter of fact, not only is the standard treatment guideline up to date, but it's also on the Spark app, which is another program, a project of the Commonwealth Pharmacists Association, and which has been working, with the Commonwealth Partnership for Antimicrobial Stewardship, that is being coached by here, Mr. Lawal. We have done the national launch of the Smart App that was done last year in July, I think 25th of July 2025, and what a success it was, and we've been also going across effective facilities to create awareness about the app, where you just download the app, download the toolkit, and you have access to the infection and infectious disease component of standard treatment guideline, and you can then prescribe, appropriately and without the fear of making mistakes, which has been identified as one of the major enablers of antimicrobial resistance in our country, and so many other. The national prescription and dispensing policy is also in the offing. We continue to have, interprofessional libraries that has hampered the conclusion of this document, but we are very, very upbeat, very optimistic that it's not that will be resolved, and we're going to have the edition of the policy on prescription and dispensing of medicines. I think that is one of the very important government policy that will help shape antimicrobial stewardship in the country. So we are very clear about what we need to do. We are determined to also do it within the limits of resources at our disposal, and good helpers. We are making little hits, and hopefully we'll get to a point where we say, yeah, we've also matured, and supporting the Nigerian Center for Disease Control, who has the responsibility to coordinate antimicrobial stewardship, antimicrobial stewardship program in Nigeria. So I take this opportunity to really welcome all of us here as we join the Commonwealth Pharmacists Association to celebrate our graduates. Once again, congratulations, and I wish us all a fantastic stay here.
Thank you. Well, so you have been told, and we have added, when I said, with your stroke of pen, you can change the direction. Wherever the UT activity. So, Pharmacist James, thank you, as usual, for a good job. Thank you, sir. I didn't thank you. Thank you. So, sir, you see what we have been doing is preparation. We have been preparing for the goal ahead to continue this, to start this activity. So, with the permission of the PSN president, I humbly ask Professor Titus Daily to please, the chairman of this occasion, to give the okay.
Thank you, sir. Pharmacist Mashood Lawal for the convener of this program. He has been our regular face at Bangkok University Teaching Hospital. The president, the Pharmaceutical Society of Nigeria, the representative of the registrar, distinguished guests, our graduates of today. Let me welcome you to Bangkok University, and by extension, Bangkok University Teaching Hospital. For those of you that are coming here for the first time, here we say Bangkok University is God's own university. So you are welcome to God's own university, and I do hope that you will enjoy the ambience, the environment, the green environment. So good morning, ladies and gentlemen, and our pressmen here present. So it's my great honor to share this occasion and the CW Palms AMR Impact Showcase and UK Africa AM Fellowship graduation here at Babcock University. Today, we celebrate 6 years of impactful pharmacist-led antimicrobial stewardship under the leadership of the Commonwealth Pharmacists Association through the Commonwealth Partnership for Antimicrobial Stewardship Program. This work has strengthened health system, built professional capacity, and advanced the global fight against antimicrobial resistance, one of the most consequential public health challenges of our time. Antimicrobial resistance does not affect borders. Our health system requires relentless persistence. The response, therefore, must be equally resolute, collaborative in spirit, innovative in approach, and sustainable in design. The UK-Africa AMS Fellowship stands as a distinguished example of such a response, cultivating leadership among pharmacists and embedding stewardship practice where it is most consequential at the point of patient care. I am particularly proud to know that one of our own pharmacists from Babcock University Teaching Hospital is among today's graduating fellow. That's our pharmacist over there. This is not merely a personal achievement. It is a reflection of institutional commitment and professional distinction. Babcock University Teaching Hospital has also served as a Center for Antimicrobial Stewardship Research under this program, contributing meaningfully to evidence generation and implementation science within our context. At Babcock University and by extension Babcock University Teaching Hospital, we hold firmly to the conviction that service, training, and research must advance in concert. Antimicrobial stewardship How do we continue to proceed? Do we continue to position pharmacists as a leader in multidisciplinary care? These are the questions that must be animate our deliberation today. I commend the Commonwealth Pharmacists Association, all UK and African partners, our fellows, researchers, clinicians, treaters who have made this journey possible. Your dedication is preserving the integrity and efficacy of antimicrobials for generations yet to come. To our graduating fellows, and especially to our home from Booth, we are proud of you. You depart today not merely as graduates, but as ambassadors of responsible medicine use and stewards of patient safety. It is my pleasure to formally welcome you all
today's Impact Showcase and Fellowship graduation. I look forward to a program that's as substantive and forward-looking and the work it honor. Thank you and God bless you. Okay, so declare this program open. Thank you.
This young lady, we are very, very good. The wonderful speech, beautiful, but full of wisdom. So, the next thing is my job. But before I go ahead, I want to mention the issue of a Stanley Companion app, which was one of the products you'll be seeing it in my presentation. DH, please, I shall be liaising with you on the awareness creation within your institutions. It's going to be fine. So we fix a date, maybe next month for it. Happy James, talk. So, yeah, the next one. So we have measured some of the impacts of the ACP, CW plans. But I want you to know that CW plans take place in 8 African countries: Ghana, Kenya, Tanzania, Zambia, Sierra Leone, Uganda, Nigeria, Mozambique. Malawi, sorry, Malawi. So, where please? The CPA is a charity organization made up of a National Professional Association of Pharmacy from the Commonwealth nations. And its vision, as you can see, is advance equity access to safe and effective medicines and pharmacy services. And what we do with that mission, which is to empower pharmacists, which is what we have been doing since we started the CW plans. The CW platform is so rich in terms of resources that benefits not only pharmacists, but all the healthcare professionals. So I want to urge other health workers here to also visit that website. Next one, please. This is our record of delivery. This is how we do our work. We do capacity building. We have an academy which you register for. Then we have the one that brought us here, fellowship program. And the fellowship program, the UK-ALF-A is not the first of this program. As some of them mentioned, last year we had the Alpha Fellow, the original African one. No, it was when you saw the success of that, they now decided to bring the UK pharmacist. But luckily for us again, you see, there's advantage, disadvantage, and advantage in anything. Japan has left us dry, but Japan has also led us to taking some positions abroad. So some of the pharmacists, they are collaborating in this program, also Nigerians. So we need one day, they will do that to manage. They have acquired them. So we have this SPARK program, which has to do with data. And this institution also benefited from SPARK, phase 1. So, but this one took place in other 5 health institutions. I took them out of it because they only benefited from CW plans. And then we have advocacy for action. Like all our activities is reported to the health ministers of Commonwealth. We work with WHO. We also send our reports to the heads of state meetings of Commonwealth nations so that they will know that there's fire on the mountain and we need their support. So next one. Well, we all know everything about antimicrobial resistance, including me. Maybe only a few people do not know that I'm an EMR survivor. It wasn't a palatable. In the part of dealing with it, I also contracted COVID-19. I was on oxygen COVID went away, my AMR remained. So that's how serious it was. They sent me back from the National Hospital. The director, go, your COVID is gone, it's the AMR. It was so terrible. I lost my mother. I could not attend the prayer, not the prayer. That's how terrible it was. So AMR is a that system from us. I must do all really possible to contain it. Go. We know this that I got to state it. But if I don't see people like you will not believe. Some people will not believe that professionals. When what call is came, COVID came. People actually some Nigeria do not believe there was COVID. What's the reality? Move ahead. These are the threats. These are the weak points that AMR attack. And it will scatter everything about healthcare. And the very thing about AMR is that it does locate the sort to start with an infection. It could be a fracture. And then you get infected. And then they will battle it to the inmates now. They can put the bones together, but there's something that possibly is even preventing them from carrying out the necessary procedure. If they don't get rid of the infection, they will not be able to do any other thing. So they have what can cause all the challenges. So we need to work on our data, because without data and proper reporting and presentation, we will not know the state of the status of what we are facing. Before. Yes, this is what I've said. We need to work on data. Not only must we gather data, we must make it a culture to take data. And in that case, we must invest in necessary technology. The issue of EMR comes up here. The CMD, at least you are here out of the 5 CMD. So I can plead and beg that you please ensure that the CMD in Bangkok works, and when it works, it incorporates elements of AMS. We also have to look at our laboratory. When you get to some of our teaching hospitals, general hospitals, big hospitals, the status of the laboratory is something. I was one of the oldest hospitals in Nigeria. I had to tell the management of that hospital that they should not just build extra ring road, that the hospital also need another ring road. That was an hospital established in 1920 something. I won't mention the hospital, but those costs I already know the hospital I'm taking off. So we need to invest in our laboratories, because there's nothing we can do on EMS without a very sound and efficient laboratory. Move on. So the proper advising proper priorities move. We have done that through CW pumps and SPARC. So these are the things we focus on: infection prevention, community pharmacy, which you have done very well, SFMS, that is substandard and falsified medicine detection and reporting. That constitutes a very key component of the national drug policy that requires institutions that store drugs and uses drugs like this to have what we call a mini quality control laboratory. Tests, outcase tests, distribution tests, as simple as that, can tell you about the validity or the usefulness of that drug. If you buy paracetamol and you leave it in an appropriate fluid environment, and it doesn't dissolve in 1 hour, so how will the patient benefit from it? So CMD, your predecessor, Professor Jonathan, I think, okay, promise us that he committed himself to it. And I want you please to look at it. It's a long time benefit. It's not just for now. And we have the University of Nigeria Teaching Hospital that help us in that. So move on. So this is what we did, the technical aspect of it. Our method of operation in this last phase was what we call through the upper spoke method. A kind of mentoring. We had University Teaching Hospital, mentoring 5 health centers, secondary, so also what we call the University of Calabar Teaching Hospital. But also did the same thing. This place also work with other teaching hospital. On the CMD, I'm happy to report that the impact of that work at OAUTH is tremendous. And I want to pray with Professor Charles not to abandon them. You have what you have said all these things. And then we also, in some of the countries, like Uganda and Kenya, they actually advance the cause of human health political concept. In Nigeria, we also did. It's only because we are not holding this meeting in Abuja. And we don't have the funds to bring everybody here. All the ministers, 4 ministries on that AMR platform were involved. Like the animal health standard treatment guideline is on our hand. So move on. So we have some tools. We have the game we develop. We have tools which you can, as I said, if you go to the CPA site, you get all these tools. And they are very, very educational. And as I said, although we cannot change it from CPA, but it is for all healthcare professionals. Move ahead. So, service delivery with the cities, prescribing companion medical product, we did the standard workers of standard. If you see some of the presentations today by the fellows, we work on substandard products. Substandard products is a challenge for us in our country. CMDs are substandard, I'm sorry to interrupt you, but I've got a point I'm going to state. Substandard falsified medicine is a big challenge for us, mainly because we do not produce most of our products. And our assistance is strengthened. When COVID came up, I was the director of food and drug services in the country. India came up with a policy. No more exploitation of raw material and finished products. We spend money on India and China for these products. And because we do not have access to them when they are not even denied to the factory, all sorts of things come into this country. But that's why the issue of number one, proper procurement of medicine in line with drug policy is very, very important. The drug policy encourages us to procure medicine directly from manufacturer or importer or at once major distributors with addresses. As philosophers says, do not deal with anybody who has nothing to lose. So you must, when you go to these people, they'll be conscious of their reputation. If it's 5 billions, they may a single accident or carelessness will send them out of business. So I want to encourage the CMD, knowing fully whether this is a private institution, there is no order from above that the director of pharmacy should take drugs from a wrong source. Then supplement that with the quality control laboratory and taking for that. So leadership and governance, the ministry is doing that. The Commonwealth of government, okay, I told you the CPA, the fellowship. Before the Alpha fellows, chief for pharmacy in UK, were the first set of people to do the fellowship. And it was based on that success we did the Alpha fellow. So next slide. Yes, move on. These are the rich we've made. It's been tremendous. The CPA activities are in over 200 countries. Health workers have been trained. We have close to 10,000 trained in Nigeria. Across the, not only pharmacists, doctors, nurses, microbiologists, cleaners, and administrators have been trained. We have had interventions to 20 countries, and there have been so many interventions at sites. A key measure of achievement, which we all know, is a youth decision, which is now going on in the country, to discontinue the use of antibiotics after children extraction. It was a practice, like a daily prayer, but it has been stopped and there has been no accident, no negativity. So that's a plus. Move on. So CW Powers, as I said, is in 8 African countries. As PAC, we have 22 countries, including Asian countries, and as PAC, 17 of them are there, already have their schools. So if you go to that, it's not only Nigeria that you want to go. You have access to about other 17 countries. So you can also learn from that. Move on. This is where we are in Nigeria. CW Powers. So, and you will see that it's loaded in the south. Again, it was not deliberate effort. Because if the third parties are not weak, and if you do not align and the criteria, especially of MOU, you cannot be selected. Move on. So in numbers, this one has gone. Move on. This is Nigeria factors. This is of July. We have 17 health institutions, including healthcare, with active antimicrobial stewardship committees in Nigeria, where I CW Powers. So we have guidelines, we have action plans. Move ahead. So these are the other things that have been developed. Move on. Now, we have talked about this. This is the leadership. To also select supervisors for them and to make sure that the activities they are carrying out, they are key components of their EMS committee work. You'll be seeing some of this work later. Move on. These are the content of the program. As worship, referral change, healthcare leadership, global health. So, move on. So, you also had what we call an online mentoring program. Maybe some of them will also be taking certificate study. In all, we have 32 Alpha alumni. Move on. So, these are the reach and impact of the prenatal fellowship program to improve AMS practices through training and awareness, enhance ability and apply data insights, touching evidence-based decision-making, capacity building for AMS, institutional recognition in AMS nations, national AMS.
Yeah, please. First, Yeah. Yes, I can hear you. I have. Hello? There, there is no one. There's not even. It's no one. It's echoing like that too. It's echoing like the other one. Yes, like the other one too. I think it's okay. No.
And trend of antibiotics consumption between 2019 and 2025, according to the WHO aware categorization, then to compare the use pattern at the University College Hospital before, during, and after COVID-19 periods. Those were the objectives. Going to my introduction, we all know what the challenge of AMR is, just like Pharmacists mentioned. And in Nigeria, the challenge is a dire one. Nigeria is not excluded. And while Nigeria was still trying to battle the challenge of AMRO, COVID struck. And with the advent of COVID, they find out that a lot of institutions were still trying to manage, get protocols on how to do COVID. During that period, they find out antibiotics were most times wrongly used for viral infections and all of that. And in UCH at that time, we find out that no study had been done. There was a gap. And I felt it's necessary we look into this space and see what really happened during the COVID pandemic period. So that led me during COVID-19 period, find out of key important Activities. On if it is not in usage, it focus it is Uni memorials and all of that. Activities going on every day. And these activities are meant to strengthen AMS within the facility. Adherence to hospital guidelines and policies, which promote targeted therapy for infections, thus relying over reliance on broad spectrum antibiotics. Remember, I said that in my findings, 80% of the total antibiotic consumed belongs to the broad spectrum. And if there is an adherence, a reliance on guidelines in the hospital, which is in place already, we find out that that will be checked. Prescription restriction for antibiotics in the watch and reserve category. If we put that in place, prescription restriction, I think that's one of the low-hanging fruits which we can explore and use to save that situation. Remember, I talked about the 120% increase in carbapenem consumption. Then consolidating on activities which are currently ongoing within the to institutionalize AMS activities within the hospital. If those activities are consolidated, definitely some of these anomalies which I would spot in the consumption will be taken care of. Thank you very much.
You have seen your picture. Come out. Yes, thank you. So please, also note there is room for questions and answers. So take note of what they have presented. And we want questions or comments that we guide further work on what they have done and intervention that they could take to save the situation. Oh, yeah.
Good morning, everyone. All protocols observed. The title project is antimicrobial consumption tracking and reporting. And my objective is to strengthen antimicrobial stewardship activities at the National Orthopedic Hospital in Enugu. This my objective is part of the objective of my partnership, the University of Nigeria Teaching Hospital, Itukwuozala, and the University Hospitals of Derby and Burton in the UK. The remaining objective is to sustain the AMS gain at the UNTH and advance the quality control hub thereof. The next slide, please. So, antimicrobial consumption is an AMS strategy that serves to regulate the use, overuse, and the inappropriate use of antimicrobials, which, of course, the use, overuse has been identified as one of the key drivers of antimicrobial resistance. So antimicrobial consumption provides insight into antimicrobial prescribing practices, trends in consumption, and the identification of areas for targeted intervention. The project was carried out at the National Orthopedic Hospital. Of course, we used the pharmacy data, we used the tally cards available in the pharmacy main stores, and the raw data was input into the WHO AMC tool that is available online, converting the data to DDDs, that's the defined daily doses. Of course, the work we did we collected data for 22 months, starting from January 2024 till October 2025. Along the line, we were able to train pharmacists in antimicrobial consumption data collection, and we also use the quality improvement tool called the run chart to look out for special cause variations in the data we are collecting, which will help us to identify areas that need intervention. The next slide. So this is my result. Over the 22 months, we encountered 21 antimicrobials with over 27,000 DDDs. And okay, and they were separated outpatient and inpatient data, with the outpatient being significantly higher than what we have for inpatients. Of course, the prevalent route of administration is the oral, which is the good one. But when it comes to the aware classification, we found out that the aware class, that the watch group antibiotics were more consumed in the institution. You can see from the table of the most consumed antimicrobial, those ones that were highlighted of the watch category. Then representing the most consumed antimicrobial in the inpatients is the cefuroxime. That's the run chart that is given for cefuroxime antimicrobial. You can see the spike there is a special cause variation. And when you notice the kind of spike, it's an opportunity for you to ask questions and try to drive change on why that place is very high. The next slide, please. Then coming to my recommendations, with the dissemination of this kind of outcome and output, it will encourage institutions to also carry out antimicrobial consumption, a kind of aligning with already existing policies and directives on antimicrobial stewardship and their quality improvement. If possible, it should be included as one of their key performance areas. Also, at the institutional level, I hope to continue the antimicrobial consumption surveillance at the institution because of the Johesu dispute with the federal government. We're supposed to do a plan, do, study, act model for improvement, but it was not possible. So that will continue, the cycle will continue. Then it will be, for some institutions, I know they have a electronic inventory management system, but for me, I have to be going through tally cards. So if institutions will be able to have the electronic inventory management, it will help this kind of studies for both data collection and analysis. Then finally, if there is antimicrobial resistance anywhere, it means there is antimicrobial resistance everywhere. So for institutions where they have new employees, that antimicrobial consumption should be part of the orientation that will be given to new employees, whether they are pharmacists or not. Then existing platforms like the one we come from, the Commonwealth Pharmacists partnership on antimicrobial stewardship should be sustained and, if possible, improved on. Thank you. A good one. Oh, yeah, next one. Ah.
Thank you very much. Good morning, everyone. All protocols duly observed. I am Olajide Abimbola. I am from Babcock University Teaching Hospital. And during my UK-ALF-A fellowship, I was opportune to do a project titled Promoting the Rational Use of Antibiotics in Babcock University Teaching Hospital using a cloud-based digital tool. The project objective basically was to assess the consumption of antibiotics in our facility and to compare this with the WHO recommendation, and also to increase pharmacist participation in antimicrobial stewardship activities. Next slide, please. We all know that we are all here because of antimicrobial resistance. That's the common thing that has brought everyone together. And in a bid to fight this resistance, the WHO gave recommendations and classified antibiotics into the AWARE classification, which is the watch, the access, watch, and reserve. And they gave a benchmark for the use of watch, which is 60% or more of all the antibiotics used should come from this, from the access group. In Babcock University Teaching Hospital, we are in a fight against antimicrobial resistance, of which capacity building is one of the core activities, and also surveillance of antimicrobial consumption. And that is one of the things that I got from the project. Prior to this project, our pharmacy department utilized paper documentation for getting antibiotic related data. And this was very tedious, time consuming. And so the initiative to bring in a Google Sheet was introduced to help us properly document antibiotics data. And we had trainings on this for the pharmacists in order to educate them on how to properly use the Google Sheets, which is a cloud-based tool where our data can be properly stored and kept. And also the pharmacists were trained on antimicrobial consumption. So we can say categorically that every pharmacist in Babcock University Teaching Hospital is aware of the importance of antimicrobial stewardship and can also gather data on antimicrobial consumption. For our antimicrobial consumption data, we were able to get this data and analyze it with the WHO AMC tool, and we represented this data in DDD per 100 bed days. We were also able to, please can we go to the results, the next slide. We're also able to see that after the implementation of the Google Sheets, there was a 14% relative reduction in average data entry time. And this signifies that the implementation of digital tools in monitoring antimicrobial consumption data is very, very relevant and crucial to continuous antimicrobial stewardship efforts. More importantly, I was able to discover that most of the consumption of our antibiotics actually comes from the watch group, which is in variance to the WHO recommendation. For access, we had just 43.36% in March and 34.18% in April, while for me we had 33.92. We can see that there is a decline in the use of access. Meanwhile, watch increased over the months, 56.64% in March, 65.82% in April, and 66.08% in May. However, these data are for inpatients within the hospital, that is, patients on admission within the facility. Our overall antimicrobial consumption also increased over the months, with the highest being 92.74 in May. We had very good turnout for our trainings, where we had 90% of the pharmacists in attendance. Now down to my recommendation. The next slide. From all I have said, we would see that it's an observational project research, which shows us that we need to make targeted interventions to optimize the use of access antibiotics, because they are safer and they are also narrower in terms of their spectrum of action. And this can help us curb antimicrobial resistance. And also, I would like to plead that we have a very robust digital tool such as the EMR within our facility, to help us with continuous antimicrobial consumption surveillance within our facility, which can also help us take informed decisions in antimicrobial stewardship efforts. It is very, very important that there is a continuous training of everyone involved, not just the pharmacists, but all health workers within our facility, so that everyone is able to take antimicrobial stewardship as part of their job, as one of the necessary things that we need to do in our fight for this. Antimicrobial resistance is a threat to everyone's life. Just as someone said, antimicrobial resistance anywhere is a threat to everyone wherever they are. And I would like to conclude that it is very important that we continue the surveillance of antimicrobial consumption. That is, as it is very difficult to argue with very, very, very crucial data. Thank you very much.
Yes, the next slide. Bessie, where is he? Ima? You didn't catch you?
Good morning, everyone. My name is Emmanuel Bassi from University Hospital. My name is Emmanuel Bassi from University of Calabar Teaching Hospital. All protocols duly observed. My project title was the prospective study of antibiotic consumption patterns at the University of Calabar Teaching Hospital for the year 2025. Objectives included but not limited to access AMC at the University of Calabar Teaching Hospital for the year 2025 and to use the data to drive positive change in AMS. As we are aware, the rise in AMS globally, in an AMR rather, globally, has brought a lot of financial and health challenges. And one way to tackle this is to understand AMC patterns. And the University of Calabar decided to undertake this project. And what we did was gather data from our inpatient and outpatient pharmacy, standardize the data using the smallest dose for each formulation. For example, 1 tablet represents the smallest dose for oral forms, and then vials and ampoules for injectables. And then we use the AMC2 2019 version, that's version 1.9, to calculate our DDD. Graphs are not present, but we have submitted it to the CPA. Some key findings we discovered was that pre-intervention, we had the watch antibiotics in the inpatient outlets than access antibiotics from January to July. We started our intervention between July and August. And you could always, when you draw a chart, bar chart, you would always see that the watch antibiotics for the first 7 months always were higher than the access antibiotics. And we know very well that access should always constitute 60% at least of your total consumption. So we did a root cause analysis for why we had that as our baseline. And one thing we discovered, of course, even if you prescribe but you don't have access antibiotics on ground, then you won't achieve your purpose. So we began to restock access antibiotics, both as tablets and injectables. And what happened between August and October, when the and 1st November, when the strike commenced, is that you begin to see the access group of antibiotics beginning to, and if you study our percentages of oral to injectable consumption, pre-intervention, you would always see that the injectables, particularly in inpatient, were always high. So interventions like de-escalation, you couldn't have them because there were no tablet forms. You would always have injections, and then once the patient needs it, he has to source it outside or whatever. But when we started bringing in access group of antibiotics, you could see rise when you draw a bar chart. You would see the tablets began to increase, and then another key finding we had for inpatient pharmacy outlet was that ceftriaxone was the most consumed antibiotics among the watch. And for our outpatient data was fairly decent. We always had access being used, and the most commonly used include amoxicillin, doxycycline, and amoxicillin clavulanic acid. And those are all oral dosage forms. Our outpatient departments usually focused on the oral medications. Some recommendations from our findings was that we needed to promote targeted antibiotics by utilizing available resources and expertise, and the available resources and expertise of the microbiology lab. One of such is we're setting up a procedure where when patients are rushed in, particularly for accident and emergency cases, where you know they are always going to be, or there's a tendency that they'll be transferred to the wards, you should start with the access, draw a blood sample, send to the microbiology lab. That way, if you conduct your PPS, you see that there are some prescribers who only know Rocephin, headache, Rocephin. So, but with interventions like this, where you have it on as a guideline that when patients are brought in, draw a blood sample, send to the MCB lab, start the patient on access antibiotics, and then thanks to the CPA, the University of Calabar Teaching Hospital has backed alert and Vitec machines, so that helps to speed up our investigation processes. Other recommendations, like I've said, encouraging the use of access antibiotics until there is a proven need for watch or reserve antibiotics, strengthen our infection prevention and control activities within this facility, and support the AMS committee on hospital-wide training for all staff. And we must also continue to sustain the availability and distribution of access group of antibiotics across our pharmacy outlets. Thank you very much.
Thank you. Well done. Next one. Yes. Èkó for sure. Èkó ò ní bàjẹ́. Ó bàjẹ́ tí.
Good morning, everyone. Standing on existing protocols, I would like to present my project. So my title is Quality Assessment of Antibiotics in Lagos State, Nigeria, a comparative study of regulated health facilities and open marketplaces. So my objectives are as follows: to determine the prevalence of substandard and falsified antibiotics in Lagos State, to determine the prevalence in open marketplaces, and then to compare the two. Thank you. So everyone has been talking about, aware classification of antibiotics, doing the things right, not taking antibiotics unnecessarily, and all that. But if we all do everything well and forget that we need to check the quality of our antibiotics, then we started to work on very fragile foundation. So that is the essence of this work. Now, for methodology, I went with I had a lot of antibiotics to analyze, to check whether I could detect substandard or falsified antibiotics among them. But before I go into that, I'm going to talk about all the challenges that I faced because unfortunately for me, starting with the facilities that I used, none of them had a quality control lab. So I had to keep making plans, trying out, going back again to the drawing table until I discovered that UNTH in Enugu had a good quality control lab, and I had to go down there to analyze my sets. Then I could have done it in some other places in Lagos State, but it was quite expensive. It was easier for me to fly to Enugu than do the tests there. So now to continue my story of woe, when I got to Enugu, there was strike. And everywhere was shut down. So I had to find an anchor person. The SF Med champion in Enugu had to assist me to be sneaking into the hospital to go and do some tests. So on the days that we managed to go, I was able to analyze 14 samples of antibiotics. Now, unfortunately, I couldn't do all these tests to all the ones that I worked on, but I did something and I got something. So out of my 14 antibiotics, I was able to do weight uniformity tests. I did, for the tablets, I did disintegration tests, and then I checked the percentage drug contents. Next. So my results from my little work showed me that out of the 14 samples that I did, one failed the disintegration time test. One failed, the same one actually, failed the weight uniformity test. You know, it's very worrisome that you get a tablet that is supposed to contain 500 milligram of a drug, and then the tablet's weight is not up to 500 milligram. So you now wonder, where's the weight of the diluent? Where's the weight of the other things that are inside? And you know, so then I now did the drug percentage content. I did for just ciprofloxacin samples, 4 of them, and out of the 4, one failed, but surprisingly, it didn't fail because it was under. It failed because it was over. I had 160-something% drug content inside. And you can imagine, you know, imagine you decided to say, okay, let me give this patient a loading dose. And you give, you know, twice the normal dose to start. And you know what you're doing to that patient. And it's good to note that all these drugs that failed came from the open marketplaces. So I will have to do another research to find out why, whether it's the storage facilities, you know, or you know the way the drugs are handled. We have to find out why. Exactly. I didn't want to say that. So now to my challenges. The first one I'd mentioned that we need to get a basic minimum of quality control labs in our facilities. You know, it's good that when I went to do this work that there was strike, because of the strike, I had to be ingenious. I had to manually do the disintegration time tests, you get? And I saw, you know, it makes you, when you're doing it, it's as if you're there with the tablets, you're with the molecules and all that. So you now wonder what is going on inside the system when you give this drug to a patient. You give an antibiotic, and it takes you 1 hour to dissolve an antibiotic. So then another challenge was the high cost of the test I'd mentioned before, and then the 84 days health workers industrial action. So my recommendations. First, I didn't want to say, I really tried not to say it first, but it can't be overemphasized. The quality control lab, you know, should be set up in every facility. Even if it's just to weigh the tablets, you know, pick some at random, check and see whether they pass that basic test. So every facility should, I thought I could also design an SOP. But I found out that you check your capacity, see what you can do, and now design as you go along. Because it's not something that you buy one big machine. That's what I used to think. You buy one big machine and then you drop your drug inside and it brings out the results on the system for you. But seeing that, there's you can get a weighing machine, and you've already taken care of the weight uniformity test. You can do the manual disintegration test, and it gives you a lot of information. So we can actually, face the low-hanging fruits and start with those tests. Then, we also, it's good to realize that we should know where we source our antibiotics from. Some of them are heat labile. I remember in one of the presentations we made in Lutz, I said this, that when you have a sachet of co-amoxiclav tablets, and you start noticing that pillow effect, yes, you know that you're in trouble because the drug has started disintegrating. It has started, losing potency because it's releasing, there's a reaction going on and it's releasing gas. So it's causing the blister to swell. So we have to be careful how we source our antibiotics. Thank you.
Thank you, everyone. We've listened to the 5 fellows. So please, questions, comments, advice. 100%, no question. No intervention? Yes, Pharmacist James.
Well, I'm very sure that I'm just opening the floodgate, because I know that certainly comments, contributions would come. Just permit me to really, once again, congratulate these graduates and appreciate the great work that they have done. It's remarkable, it's revealing, and it's also very, very informative. I think I just want to, for me, the studies are very much, have a lot of similarities than dissimilarities. I want to therefore, because, the WHO aware categorization is essentially what most of our fellows, all our fellows, have used, and that's quite understandable, because probably at the time we didn't have the national aware categorization. But like I remarked earlier, we now have the national, that's Nigerian aware categorization of antibiotics. So you should try and factor in that in your studies, even if it means using both side by side, but at least our own categorization should also enjoy some consideration in similar studies going forward. Secondly, this is a suggestion, just to point out that it will be good if all the fellows would consider consolidating the studies and merge it into one study and see if we can have a publication out of it. I think that would inform policy and practice in Nigeria. Thank you very much.
Any other person? So, okay.
Thank you very much. I would like to say a big thank you to all the presenters. They have done very good work. because they are filling the gaps, that we observed. Thank you very much. I have a quick question for the Calabar presenter. Yeah. Yeah, you made an observation, and I don't know, I didn't notice your recommendation on that. If really, that was valid, your observation was a valid one, statistically especially, it would be a very good thing, and that is the fact that you noticed. I hope I didn't get you wrong, that when the hospital bought more access antibiotics, there was an increase in the use of access antibiotics. Please, I want you to assure me, that happened, because that is, that would be a quick win for us, if that can be done. Thank you.
I join my colleagues in congratulating all the presenters for a good job. And then you will find out that most of those studies are ongoing. You find out that most of the studies are ongoing studies. Some of them you need to go further to find out what is responsible for some of the findings. And for some, you want to carry out interventions. So we would like to encourage these presenters to continue to do more work. And so therefore, we want Commonwealth Pharmacists Association to continue to fund some of these studies. We would appreciate that very much. Thank you very much.
Any other person? Hello, no other person. Thank you. My own comment has been said by Pharmacist James, but I have another issue. If you're from LUT, mention quality control, another thing it is storage condition. Not only in the open market, our hospitals must also ensure, especially the teaching hospitals, when you buy a good product, and you don't have a good environment to store it. In an institution where it is the end of the last bus stop, so you end up giving, especially the infusions, or some Tamulabai products. So you end up giving poor quality or degraded products to our patients. So I want to urge every HPs, starting from Bangkok, where we are today, to see what they can do to improve the quality of the storage facilities in terms of refrigeration and prevention of sun rays into it. Some of these things, you don't know it, their impact. You just read it until you see them in real action. If you get metronidazole tablet that is not colored, right, as you go up on its own, and you just place it by your window, few days go and check it, it will have turned yellow on its own, which shows reaction has taken place. What you have is no longer metronidazole. I experienced this when I was doing NYC 1985. Just came out from the pharmacy, and removing my dress, I removed the metronidazole I bought, and I put it by the window. Of course, I forgot it here. When I go back to the pharmacy, I took another one. The few days later, when I went there, it has turned yellow. So we need to really improve on the storage condition of our drug facilities. Thank you. So before we go on tree break, Professor Oriagba just said that this effort should not end here. It should not end here. And I think last month, January, you were also here on the issue of sustaining this effort beyond further support. So we are going to have a panel that we please briefly within 10 minutes before we go for brief to look at this issue on how we can keep on this work. It makes my fear that we say because there's no more money. Yes, money is important in everything. As we say inside movement in those days, that I'm a total so it's a modern language. So I will be calling on a panel of four. I want to bring in my president of the society, the PSL representative, Professor Dr. Okubosi, and I think that's three. And I want to bring in Pharmacists at the end. So please help me with chance. My president, please permit me to carry you on. I met my minister one day that I wanted him to do something for me. But I don't know how to state it. He said, you are the director. You better know how to direct. Yes, thank you, everybody. We have about 4 questions to go through. We just concluded this program. We have seen the benefits. We have seen the gaps that need to be filled. We've discussed some of them today. Now, given our current situation, what changes must we make as a nation to sustain not only the AMS activities, but the healthcare system as a whole? Thank you. So we start from the man holding the microphone.
Thank you. Good morning, and thank you for this opportunity. I didn't know this question was going to come this morning. But just yesterday, there was a clip that was shared about doctors that were suspended in Lagos from the death of Chimamanda's son. And it just speaks to part of what we're talking about this morning: stewardship, clinical governance, processes in our hospitals. And I hope it's going to be a wake-up call for us to really revive our health system, because we're being supported by foreign funds to set up what should operate normally.
No, we press it.
For me, I think that it's gonna be good. So for me, I think that stewardship is both a moral and an ethical obligation, because we say in medicine that above all, do no harm. Medicine that's been saving life is now the bridge of killing lives because of the way we use it. And so we really need to bring that reality to the knowledge of people in governance, and I thank God that FMOH is here represented. So I hope they'll get this message back. And I tell my colleagues and doctors that I hope that they sue doctors more, because that's the only way to improve our system. I'm sorry, but I think they should sue doctors more and sue hospitals more. If they sue us more, then maybe we'll do the needful. Now, what do we need to do? All of us in this room will have a role. Stewardship is a marathon. It's not a sprint. For those that have been involved with it, it's a lot of work. It's a lot of commitment. And I kind of get excited when I see people in this room, the passion. I've worked with Pharmacist James Yakubu for a long time. I know his passion to things like this. So I think we need to infuse younger colleagues and as many people around us on the need to do the needful. And like I tell people, the next person in the ICU might be somebody that you know. Just last year, I lost a very dear father figure to me from AMR. It was very painful. So it's a reality. So we all have a role to play in our little cocoon, in our little circus, right, to do the needful. And the management also needs to prioritize those things, because from our experience on stewardship, without management support, you really can't do stewardship. So the management of our hospitals need to provide the enabling environment to ensure that this stewardship things happen. Sorry, this is fluctuating. I need some help. And they also need to hold the stewardship teams accountable. So when we had the sustainability meeting with our management last year, or early this year rather, part of the recommendation was to request a quarterly report from the stewardship committee. So if the stewardship committee knows that they're going to give, if the stewardship committee understands they're going to give a quarterly report to management, then that means that they need to do the needful to that our government needs to put their money where their mouth is. You know, stewardship is not capital intensive, but it takes some resources, especially for awareness creation and a couple of other things. The more bigger challenge is even the antimicrobial resistance surveillance part of it, which is highly state of surveillance in our country. You know, so we have a lot of latitude and gaps to cover, but I believe that we have the resources and the wherewithal, and we have fantastic human resource. I've been privileged to work with colleagues at UCH in the last 3-4 years, and it's amazing what people can do given the right encouragement and the resources and opportunity to express themselves. Thank you.
In order to save our time, Director Ogunla Adenike will be the last fellow to make comment on this issue. So the next question will be for the other two people.
Thank you very much. In fact, I have to commend the fellows. They done very well. In fact, I'm really impressed and challenged as well. We need to, from the patient angle, we need to do more hospital visits. We've started, and
think he's the only one who can give us give us the answer. My president, number one, I've commended you, commended the association for what we have done for the nation. I was informed, according to one man in Nigeria, because I was informed in this CW PAM program. And we don't want to end. And I've told the audience your promise that you will sustain the PSN on the CPA platform. But locally, will it be possible for the PSN, like we mentioned the essay competition we did at UCH that was restricted to pharmacists? We now want to take it. We decided at that meeting, in the presence of the management of UCH, to take it across the whole health sector, not only pharmacists. We want to see whether the PSN will be able to assist in organizing structure, number one. Number two, with the PSN, maybe liaising with the PCN, and then taking a cue from the CPA, institute something like this fellowship program in the country. Thank you.
Thank you very much, Mr. Lawal. What? Mr. Lawal, you are putting me in a tight spot. You know, theoretically, PSN is there to advance the course of pharmacy anywhere and by whatever means. So that tells that this says it is doable, theoretically. But pharmacists are also very, very eagle-eyed when it comes to spending their money. I don't want to go and spend money that is not budgeted for, only for which we are accused of squandering your money. So we'll take a balanced way. I will make a write-up to PSN. I will send it to the Finance and General Purpose Committee. They will recommend and attach a figure to it. We can include in our budget, and it can be done. I'll show you that.
Thank you, my president. And I want to add that as the man that was selected to represent the PSN on this job, I've been doing it. I have the responsibility to turn in a end of program report with appropriate recommendations. And I will duly make those necessary recommendations and suggest the approach to do it. Maybe that should come before your presentation to the House. Thank you. So now the last question has to do with data. AMC, AMU, PPS, we still rely on data coming from Belgium, from Geneva. So how do we ensure that all the activities going on all over the country? Dr. Kumbosi, I'm coming to you because you are deeply involved. And I know you can walk to the office of the DG, NCDC, to make this presentation. I'm concerned about it. Because without data, without figures, we don't know where we are and where we should be. So this data, we need to be gathered, analyzed, and presented to the appropriate authority. How do we make sure this data gets to the national fort? So that's the question. Mr. Marami, can we assist?
Thank you, sir. So I think your comment is very important, and part of it, Pharmacist Yakub Lawa has alluded to it, that all the presentations by the fellows today, we should make efforts that they're published. Very important, that's one. The other thing is, I believe that NCDC is part of the national oversight mechanism of this activity. And so I would imagine that the activity report, the NOM and maybe representatives from the health partnership can accompany the NOM to make a presentation to both, if possible, the minister and the DG NCDC with recommendations that would affect policy. I think those things are very important. Yes, we can publish in literature, but it's unlikely that they will come across it except they are avid readers and they have interest in reading things like that. But there should be formal representations to them with memos and recommendations on how to, one, use the data, and also how to improve on the work that CW Palms has done. Thank you.
Well, I don't want to add to what Professor Ogunbosi has already said. I just want to quickly say something on the sustainability aspects. There are a lot of pharmacists here, and once this funding came to an end, I've been thinking, what do we do? And I just want to challenge the pharmacists that are here. You know, somebody presented a project on substandard and falsified medicines. And it would be a shame if patients will purchase drugs from our pharmacies and they are substandard because of poor storage. And there are simple things we can do. Just 2 days ago, some people came to check our pharmacy. I also do some clinical trials. So some potential sponsors came to check, and they asked me some questions, and I was, so excited to answer that. Our clinical trial store has temperature control, storage facilities. We always record temperature. We have the temperature data and logger. I was so proud to showcase the clinical trials.
Thank you, the panel. We are grateful for having us have the benefit of your insights. And as I said, we'll be making a comprehensive report on and on the program as you. And as Dr. Ogunbosi said, that was my plan, that we send a report to us, copy the minister. But we will try to go beyond, if it means self-sponsor, to come to Abuja, go along with you to go and make that presentation. Thank you. And I still have my leg at the Federal Ministry of Health. So, so thank you. Before we go to the next step, please, there are going to be a little thing carrying with the agenda, because Before I do that, I want to introduce. If I talk now, it may. I want to introduce the provost of this institution, who stepped in while the program was on, Professor Adeola Fowotade. So please, stand up for the competition. When she was at UCH, but Babcock decided that they need to benefit from her wealth of skill and experience in order to also go a notch higher. So we wish you a very successful tenure, and we thank you for turning up. So before we go for the break, the CMD has been here with us. And we are supposed to go for break, have the keynote address of the PSM president. I want to plead with the CMD president and the CMD to please give us at most additional 10 minutes. The first 5 minutes will be used to give the keynote address of the PSM president. That will be followed by the presentations of certificate to the fellows, after which we will not hold you back again, sir. Thank you. So, my president, you have the floor. Sir, this is a copy of his speech.
Can I take permission to sit down?
Yes, it's permitted. This microphone.
Before I give my speech, I just want to inform the House that I was once the desk officer for the Commonwealth Pharmacists Association of PSN in Nigeria. So for 3 years, I was in charge of CPA. In fact, I even attended an international conference in Durban, South Africa, on behalf of PSN for CPA. So I'm very much aware of the activities of CPA. And now that I'm the president, it behoves on me to do something a little so that the presence of CPA will be felt within Nigeria. And I promise to do that. It's an honor to join you today as we celebrate the collective impact of our shared progress in combating antimicrobial resistance in Nigeria. Let me begin by extending my deepest gratitude to the Commonwealth Pharmacists Association and to Global Health Partnerships, formerly THET, for the visionary leadership and this unwavering commitment to the CWPAMS and SPARC programs. I also appreciate the implementing health partnerships, their management teams, the Nigerian Center for Disease Control and Prevention, Look Blue Solutions, that's the program manager in Nigeria and Ghana, and the in-country consultants for their dedication and sacrifices. This critical work has set a benchmark for excellence in health partnerships and pioneered innovative approaches to addressing AMR, which help protect our communities. These efforts strongly align with our national AMR priorities. Through multiple avenues, including the UK-Africa Health Partnerships, UK-ALF-A Fellowship, clinical microbiology strengthening, substandard and falsified medicines initiatives, community engagement, and digital innovation, you all have collectively strengthened antimicrobial stewardship across health systems. Across hospitals, laboratories, community pharmacists, and policy platforms, you all have translated technical expertise into measurable improvements in antimicrobial stewardship practices and system-wide capacity. By doing so, we have solidified pharmacists' roles as custodians of responsible antimicrobial use. Key to this progress is empowering pharmacists and multidisciplinary teams to A. Make informed decisions. B. Lead by example. And C. Drive behavioral change among healthcare providers, patients, and the broader community. Our fight against AMR, these skills are vital in building a resilient healthcare system ready to meet both present and emerging challenges. Today, we recognize the remarkable contribution of the UK-ALF-A Fellows, alumni fellows, mentors, SF Meds, champions, community champions, health partners, and national stakeholders who have driven this impact forward. Your dedication, collaboration, and technical leadership have strengthened antimicrobial stewardship across institutions and communities. To our graduating fellows, today marks not just the completion of a fellowship training program, but the continuation of your responsibility as national leaders in antimicrobial stewardship. However, our work must not stop here. We must ensure that the gains achieved across all programs and work streams are institutionalized, scaled, and embedded within our national health systems for long-term impact. I challenge you all to take ownership of the progress we have made and to lead other innovative projects that strengthen EMS, not only within your own hospitals and institutions, but across our entire nation. With the skills and knowledge you have gained, I encourage all of you to mentor others, extending this positive momentum across the workforce. I urge you all to continue pushing boundaries, collaborating across sectors, and sharing your expertise, not only to sustain our existing achievements, but also to inspire the next generation of leaders in healthcare. The progress being showcased today demonstrates what is possible when global partnerships align with national priorities and local leadership. As we look to the future, let us remember that every step we take together is a step towards combating AMR and ultimately creating a safer and healthier Nigeria. Let us continue to move forward together with shared responsibility, collective accountability, and unwavering commitment. Thank you very much, and God bless you.
Thank you, sir. Fellows, I think you have had the the responsibility that has been given to you. You accepted to be here today. You made effort to be here. And it's the beginning. It's not the end. So we will, because we need to release the CMD, we'll be doing the award to fellows. The other recognition will continue after our tea break. So give me that cutter and the ladder. No, the cutter and the ladder. Look for this thing, this one. I have to change it because of it. I want to show you. Hold it. That's one. That's fine. That's clear. That's what I didn't want. Where is it now? Okay. Where is this thing at? Supposed to be 5. This is also to be 5.
This is for each of them. This one is just 5.
It's 5. One of them are 5.
Do you understand?
No, not this one. This is the one. This is part of it. This is part of it. This and this is the fellow graduation. Sorry, we had to take some time because we didn't prepare for this stage now. Are you going back? So you are going to? What is it doing? What is ready? And you guys a presentation down. You guys a presentation of certificate. What's he doing like this? Okay, yes. So, Mr. Chairman, so we have a procedure, sir. We call the name. The fellow will come out. The PSN president. The fellow will proceed to the chairman of the occasion. Take a certificate. Then the fellow will proceed again for that. To the representative of the register pharmacist association. Just to so, thank you. So, the first name is the man from the land we love to stay. Calabar is beautiful. Calabar is clean, although they are spoiling it now. Yes. The Calabar is where you get your downfall buses. Very neat, not like the Lagos. So, Imam Basi, congratulations. proceed to take your certificate. Okay. Background. Can we move a bit here? Background. No, shift it, please. Background. Thank you for the observation. Okay, okay. It's in that order. It's in that order. I've given the certificate to you. It's in that. What is next? Eh? Okay. What's next? Okay, I thought. No, pass is on.
Who is next?
Okay. The next one, Abimbola Olajide. Clap for your own now. This is Alapela. This out. Yeah, carry this one. What's the next? Kayobari Victor Olowai. Olowai. Okay, thank you. All right. No, come and see me. Genevieve Mogalu. Oh, now your color. Now your color. So join them. Join them. Join them. Join them. The last but not the least, Ifeoma Julia Obi Eko. So join them for a good job. Please don't sit down yet. Move close, move. Move towards us. Okay. Are we all right? No, I'm not. No, go take.
Yes, so
They are going to use this first. Sir, don't take the picture yet. Come. Can we close that door? They will do that. I'm going to do that. Certificate. My president alone. It remain 2 operations you take. 2. Are we all right? Yeah. Provost, please. CMG, please. What about the report on Friday? What are you serious? Oh, yeah. Wait, thank you, sir. All the HP leads, HP leads. Thank you, sir. Hey, Victor, get me 2 more chairs. Are we taking more? Yes. I can't really jam a GC. Oh, yeah. Thank you. Yes, you can. Thank you for talking. All the HP leads to the base. Oh, yeah. Thank you, sir. We are honored, sir. Thank you, sir. I'll be calling, sir. All right, thank you. HB leads, so you're fast. Our time is fast, man. HB leads. Sorry, Enugu is Obama, come and represent your. What you call me? Come and represent. I don't like the lady. The chairman was supposed to be at the center. Oh, yeah. Okay, continue. Continue, c'est avancé. Avec Mikeni EMS champion. Non, tu te coupes, le canard. Thank you. Federal Minister of Health and PCN. Oh yeah, James, quick. We still have a lot to do, but because we are in this stage. Hello, Jonas, you are going to eat now.
Thank you, sir.
Go take a minute. Oh yeah.
Thank you.
Don't take it far. No, we're not taking it. Mentors. Bring the chair. Mentors and supervisors. Mentors and supervisors. Mother, are you not a mentor? Wait, don't take it now. Let me see, got to it. Mentors. Oh yeah. Eh? Oh yeah, now. See, mentors as well. When you see professionals, please, we go for tea break. For time. Tea break is here. Tea break is outside here. Tea break, please. Tea break this way. No, not home base. I'm going to start from the primary institution. Okay, let me just see. Dr. Babatunde Ogunboshi. You see, despite his load of work, he was still able to be a mentor. So, Victor, carry this cup. Ayara Bade ni yafoto ni.
For the UK Africa Leadership Fellowship in AMS. That's 2026. Congratulations. Thank you.
Congratulations. The next person, Lawa Nadamu. If you know the trip this man took to be here, you will give him another round of applause. He came all the way from Jalingo. So we are very, very careful on your dedication.
So, this certificate is presented to Lawan Adamu for being a mentor for the UK Africa Leadership Fellowship in AMS. Today, 4th March 2026. Congratulations.
Okay.
Congratulations. Thank you.
Yes. The last one is for Dr. Chineye from Onodugo. She's not prayer because she's sick. So we pray for a quick recovery. But there's somebody able to represent her daughter.
This certificate is presented to Chinenye Ifeoma Onodugu for serving as a mentor for the UK Africa Leadership Fellowship in AMS on this day of 4th of March 2026. Congratulations.
So we want to recognize the champions. I want to call on Director Nike from the PCN to please come up. Just a moment, ma. Seven. Seven. So the first person, oh no, he's not here. So let me call him. The first person, again, from the Premier University, a past winner of the Alpha Fellow, pharmacist, Olayinka Ajiyen.
The community champion, this is to certify that you have successfully completed the Commonwealth Pharmacy Association Community Champion Program. Congratulations, ma.
Thank you.
Okay, thank you.
The next person, Olubukola Kalejaye, again from Ibadan. So the me.
From Kalejaye, this is to you for successfully completing the Commonwealth Pharmacies Association Commonwealth Partnership for Antimicrobial Stewardship Standard and Falsified Medicine Champion Program. Congratulations. Okay.
Yes. The big one from Pharmacists blessing. Ameke.
Blessing, Mike. You have successfully completed the Commonwealth Pharmacy Association Commonwealth Partnership for Antimicrobial Stewardship, Substandard and Falsified Medicine Champion Program. Congratulations, ma.
Okay.
Thank you, sir.
This one our own.
Yes, sir. You're very
Let's see your teeth.
Sorry, may call the names. Uju Jukura.
So the last person didn't get the person that was there.
Okay. What's happening? Madam, this is next.
That's from Uju Shukura. This is to certify that you have successfully completed the Commonwealth Pharmacists Association's Commonwealth Partnership for Antimicrobial Stewardship, Substandard and Falsified Medicine Champion Program. Congratulations.
Thank you very much.
Sir?
Just sorry, thank you. No, no, you. Thank you. The next person is Patricia Odunoga.
Yes, sir.
This is to satisfy that you have successfully completed the Commonwealth Pharmacists Association Commonwealth Partnership for Antimicrobial Stewardship Standard and Falsified Medicine Champion Program. It's my pleasure. Like I said, I did my internship under her. It's my pleasure to give you this certificate, my former boss.
The boss is always a boss. The next person is Olayinka Adeyemi. Please, others have done well, but I want you to help me give Olayinka Adeyemi a round of applause. Because we gave her a lot of job to do, and she performed credibly well. Thank you. And I want to challenge others to follow in her footsteps. Please, link up with her.
This is to certify that you have successfully completed the Commonwealth Pharmacists Association's Commonwealth Partnership for Antimicrobial Stewardship Standard and Falsified Medicine Champion Program. Congratulations.
Thank you.
Please.
This fellow is not here because it's the fellow I told you he's already a PhD holder and he's still doing exam. So he's busy in the classroom doing exam, but he's ably represented by one of his colleagues. His name is Chikese Okwele Okusilese. So he's presented by fellow You are a fellow now.
Yes, sir. Yes, sir. Yes.
Embassy. Thank you.
I know it.
Okay.
She's not collecting the ticket.
Where the so was it in here? You are very clever. Yeah, it's a last group. There's a last group. We call them the CW Pass Alumni Mentorship Program. And I want to call on Professor Charles to please come up. Who's an Isaman here? Isaman. And there's nobody from Urumi and all these things. Yes, the best person here is Iwauma, India, Excellence, Fidelis, Ewa. You know the name is long. They are the one always have. Okay. The next person is Fifian Chuka. Lebede. Give her. And the key card is something. You give me the first.
Thank you.
Oye, go to the left. I will find a book. Go quick and let can. No. Go quick like an. Robosi. Go quick like one what has been like. The last but not the least, and it's good she's coming last again. She's the last person. Because there's a pair of this big Pharmacist. Olayinka Adeyemi. So when I told you she was engaged in so many things, and she did very, very well in all of them. Professor Ogunbosi, thank you for identifying her, for challenging her, for bringing the best out of her. Prof, we are grateful. Thank you. So we are gradually coming to the end. Yes. Put on my something. Where that one is going on, I have a brief talk to give to the graduates. So please, your attention. Your attention. Yes. Why? Sorry. Where is that other line? With the sticker, with the stick paper. No. Let us kill fellows. Between you decide who is going to give follow tax. Vote of tax. Between you. Open it. Please, this sticky paper it will be distributed. If you look at the agenda, we want you to do something, tell us what you have learned. And if possibly, what you feel we should have learned. So thank you. They will distribute it. While I'm talking, you do it. And to be collected later. Again, those who have receipts to give me, please give me today. Yeah? Give me receipts. If you have any receipt to offer me pertaining to this program, do that. So, dear fellows, you all know me. Thank you. People have, so much have been said about this. What next? The president said it. The chairman said something on what you should do after graduation. You get it? So next slide, Victor. Leave that one to him. No. Okay, this go here now. Go to Didi. Go to Didi. Escape. Sorry. So go to the next slide. Go to the next slide. Go to the next slide. Yes, these are definitions of fellows. When you look at it, I won't read them out. It shows that this group called fellows, they are a special group. In either field you want to talk. In our society, we have fellows of the Pharmaceutical Society. All professional bodies have it. Then we also have academic fellows. These are selected, privileged people, given certain assignment to do, got some training, and at the end of the day, some even enjoying funding. You get it? Like your own, if you had to pay for the courses you did, it will be around to tens of UK pounds. So you were funded. So, and I said becoming a fellow is a profound honor. It is a profound honor. So please, you are an honorable person, and the best is expected from you. Next one. These are the key words. For a professional association, it's the highest grade of membership, which must have come after recognition of services rendered. It's a privileged member. If you go to PSL conferences, when you are sitting down, they say, rise up when the fellows are coming. You get it? Specially elected, yes, it's not an all-comers affair. It's a prestigious recognition of significant accomplishment. Leadership and measurable impact on the profession. So it's a testament of sustained excellence and contribution. Next one. Now, I have this quote from the Bible. It says, Luke 12:48, but someone who does not know and then does something wrong will be punished only lightly. Where someone has been given much, much will be required in return. And where someone has been entrusted with much, even more will be required. Please attention. Hello? You agree with me, you have been given much. You agree with me, you are privileged. So much is expected from you, and get prepared. Now, when you look at the first sentence of the quote of the Bible verse, it says, when you have done something wrong and you don't know, there could just be a reprimand. But it's going to be a disaster for you. Number one, you're a pharmacist operating on the principle of all or nothing. Now a fellow trained, not even a professional fellow, but a kind of academic fellow, expected to do the best. It's going to be wrong and terrible for you to purposely neglect your responsibility or doing knowingly do a wrong thing. The society will not forgive you. Humanity will not forgive you. Prosperity will not be pleased with you. So know what you are in. Next, no, go back. Go back to it. So the next quotation say, from Spider-Man, with great powers come great responsibility. You have been endowed to do wonders. So please know what you are in. Move on. Yes, our expectation, you continue to be a caregiver. In doing that, you must be compassionate. You must have adequate technical knowledge. You are a decision maker. Don't say you are assistant director, you are deputy director. At any level, you can influence decision with positive presentation. So, you are a policy developer. What you observe can lead to policy changes, especially with AMS and other issues. Next one. You are a communicator. You communicate with everybody in the healthcare system. You get it? You are a focal point. You are the fulcrum, as we say in physics. You get it? Yeah, you are a manager. You are a leader. So, next, you are a long life learner. Learning does not stop because you have obtained a certificate. I told you of Dr. Okeswile that is doing exam after PhD because he wants to be a better person. And the beauty of acquiring knowledge is that at the end of each process, you are a different person with enough confidence and courage. Then you are a teacher. Don't keep the knowledge. According to one popular book, it says, die empty. That is, try as much as possible to give out what you know to others. It doesn't make you a lesser person. It rather reinforces what you have learned. And it also lessens your job. When the person next to you knows what to do, it means if you are to do 100% of the job, you could end up doing 50%. You have someone to delegate. But if you keep the knowledge to yourself, you're on your own. Oh. Yes, these are the tools you need to do all this job. You must have integrity. Without integrity, whatever you attain in life is zero. People should have confidence and trust in your personality, in your judgment. And you are in a profession where you don't have option. When I'm supposed to take Cefrozan, and because your friend is the one selling erythromycin, you now say, give me erythromycin. That is not acceptable, you know. So integrity is number one, but it's not enough. You must also have technical capability. Yes. We had a national experience a few years ago where we had someone with integrity. Nobody doubted his integrity. But we later realized he lacked technical capability. We hope the nation will get out of it. And then you cannot do anything without your health. After your life, you need your health. So try as much as possible within your own capability to maintain good health. Accountability. Whether you like it or not, you give account. And I pray, I always pray, God, don't let me stand before a man like me to give account of my stewardship. It is only God that can judge you without being biased. So avoid a situation where you be called upon to account for your negative or wrongdoings. Please, let it be an occasion like this where you be celebrated for doing great and good things. You have confidence and courage. You cannot have this if you don't have knowledge and skills. So you keep on improving yourself. If you get to the word, you are doing right. And the consultant asks you, pharmacist, which drug you think will be best for this situation? If you don't have that knowledge, you will have ridiculed yourself and the profession of pharmacy. You must be a critical thinker. Yes, you must analyze situations for you to make the right judgment. You must be creative and you must be decisive. You must be positive. You cannot lead and be pessimistic. There will be no progress. There will be chaos when you are pessimistic. Everything you are doubting, you are doubting. They said, quitters don't win. And then winners don't quit. When it gets tough, the tough gets good. There's nothing a woman cannot. I mean it. There's nothing as long as I'm going the right way. And if you don't have enough knowledge, call for support. Then the responsibility. Please, if you want to learn quickly, and in a better way. Don't run away from the responsibility. Pharmacist James can attest to this. When I was in the ministry, they challenged me. I didn't know they were doing it. 30 minutes to meet it. I carry his document, go and present us. And that changed me. So please, if your guy say, come and do this. Okay, I won't mention him because it's James no fellow. He was giving him responsibility. He's a pharmacist who went to the Almighty. Oh, yeah, you pharmacist, I got to a pharmacy. Where people get 50, 51. You know, those of you who went to Ife, you can attest to that. So they gave him an assignment in the department, including this. So, and he said, okay, I didn't know much about pharmacology. I said, get out of here. I was not the head of the department. Say, you went to school of pharmacy, and you went to Ife, and you're running away from assignment. That was how he took up the job. Today, he's ever grateful to him. Pharmacy James no development. So please, don't run away from this, because at the end of each responsibility you have taken, you must have gained something positive. Then you have to be resilient. Don't just lose out at every obstacle. You get it? Then you must delegate. Delegate does not mean application of responsibility. If you delegate money to man, if you become head of department, someone has written member to member. If you sign just that member, it's no longer the property or the fellow you gave the job to. It is your property. So every word there must be taken care of. And when you delegate, you also be very conscious. You have given that in memo. Someone has written it and brought it to you and made correction. And they say, Madam, I've corrected it. Don't just say, go back, read from the beginning to the end again. Human beings, it is God that has created them. We're a dangerous species. Sometimes Professor Adewale did as minister. He will sign, approve, date, or not approve. I was not the head of the department. So one day, the file came. I told my head of the department, they have taught me of lesson. He said, what did I do? He now started signing every page of memo. Because if he has signed the last page, and the fellow has approved it, the fellow can go back and just go to the middle page and change something. I don't know what they did to him, but that was his time until he left the ministry. So please, don't be in order to implicate yourself. Because when finally, because they will see your signature, they say you signed. Your signature can take you to places which you will never imagine. For those who do not know me much, and for today, I've said so much in life. My signature took me to Ikoyi prison. My signature took me to prison. I mean it. I was detained under the grid for 23 months, please. Yes, it is because of doing this job. Yes. Those who do not know, I'm an experienced man. So when I'm talking to you, please listen to me. I did not do anything wrong. I was discharged, not even tried at the end of the day. But that is what your signature can do to you. So be careful what you are paying your signature to. It does not mean you should talk it. Run away from taking responsibility. Don't say I don't want trouble. When you are supposed to endorse something, you say no. Just make sure you know what you are doing. Emotional intelligence. You must know how to deal with situations. Please. Watch your environment. Your staff. See how they feel. Attend to them. Be compassionate. Please. And then you must be flexible. Yes. There are guidelines. There are SOP. You may not tinker with the content of the SOP. But you may tinker a bit with the implementation, the method of doing it. As long as you do not miss the ultimate target. Then humility. There's nothing you know that there's nobody that does not know it, that there's nobody above you. I don't know how to say it in Hausa, but my papa will understand Hausa in his lifetime. We say, Kaki waka kineka. He say, who do you want to be like? What do you want to be? That has never existed. So be humble. Yeah? Not that tomorrow, the director of pharmacy will call you. So why is this woman treating me? Am I not a fellow? And you are in trouble. And then empower yourself. Empower yourself. And then try to influence. There was a situation in this country. I was sad that day. When our president said he was not interested who he works with as the Senate president. That was a very terrible statement. And it cost the nation so much. We had a Senate working against the government. We had a Senate president for the first 2 years of his office. He will always be looking like a escaped criminal on the seat. So you must be interested in who you work with. When I was in office, I didn't know they gave them a name. They called them Lawal boys. James, am I lying? And these are Lawal boys. He couldn't aim. When I give them job, I know it's done. I can go and rest. I will not give my job to someone who will put me in trouble. One put me in trouble. An assistant director. A file came to me on 27th of February. I will never forget. And on 28th, it left my office. It did not leave on 27th, probably because I was outside the ministry. And that issue did not go back to the minister until May. And I just remember one day, because I have another thing you must do. When you are delegating, make sure you have studied that thing before you delegate. So that when your fellow you delegated the job to is coming back, you already have an idea. You can even guide the fellow. So when this file got to the minister, Professor Adewale again, I went to his office for an issue. And unfortunately for me, he was treating that file. We called that day. He's my friend. We still communicate. So yeah, we called that day. When he got to the file, he said, Permanent Secretary, this issue has taken us 5 months. He did not take care of how many months he took in a Permanent Secretary office, because the Permanent Secretary by then was a Nollywood actor. Yes, we have all sorts of things at the position of leadership in this country. And until we get it right, that position called leadership, we are not going anywhere. Imagine a Permanent Secretary that will not treat fire. The only thing he does, he never used any channel in mind. For the 9 or 10 months he stayed in the ministry, it was always Nollywood. Yes, magic, African magic. Nothing concerned about the news, Nollywood. So the minister said, this thing has taken up 5 months. The Permanent Secretary look at it. It will have been all right like that. He now put the DFDS need to sit up. I went to the Permanent Secretary. He said, now you be your guy, now you go carry the blame. So please, when you give out job, follow it. Don't just sit down. Mine took that one, not because I did not follow. If I did not follow, maybe it would have taken a whole year. So please don't forget, when you have given a job, follow it up. And be open-minded. Don't say, me, I'm not a kid professor on you. Wait till concern me. You are going to be a loser. When time comes for someone to mention your name at the right place, you have nobody to mention your name. And you'll be wondering, where was Victor promoted ahead of me? I joined this job before him. So please, open your heart to receive more knowledge. And what do you call it? Now, the last one, which I color in yellow. If it pleases God to take you to a place where you are going to seek, position yourself not career development. Please, if because of certain factors, you will not be available most of the time to do the job, please don't take that job. Because it's going to redesign who you are. People will see you as a useless person. So please, don't take this job. I told you, I was director of food and drug services. And my experience, I finished this with our colleagues in the hospital, especially HOD, is that they compromised. When the compromise now go beyond control, they will run to the Federal Ministry of Health. You get it? If you are the head of pharmacy, you don't have to be an antagonist. Present your case to the management in line with the institutional rules and regulations in civic language. And insist on doing the right thing. You get it? That fellow, right from the first day, will begin to respect you. But when you compromise yourself, you start looking for money. Look, the alcohol sachet debate. I must shoot Olukulawa. Initiated the memo, wrote the memo that say we should ban that product in Nigeria. In January 2018. I signed the memorandum of understanding between the producer, the marketers, and the Ministry of Health. NAFDAC was there, Consumer Protection was there. It was war at the beginning. But I told them, on these decks, I have a responsibility to protect Nigerians. They got frightened when I talk. Because one of them said this so-called drug abuse. And I was mad at him. At the end of the day, they became my friends. And I did not compromise my stance. Left to me, my memo was fine. But being minister, said 5 things. You can see the damage that 5 years is causing. If you had executed it during the last week, whether 1 year or 2 years, we'll not be in this mess. And this is one of the reasons I don't like democracy. You get it? You get it? So please, I plead with you to do your job with full integrity, respect for it. And the sky shall be, you may not be rich like that, but you shall not lack. And above all, you will be so happy with yourself that the whole of that will take the and not give it that. Thank you for listening. No, I'm not taking picture with you. Your pictures are not complete without it.
It's been a remarkable the journey has been very intensive, demanding, but we made it this far. So we are grateful to God for all the support we got from our mentors, our supervisors, and we are using this opportunity to say thank you to Commonwealth Pharmacists Association for giving us this privilege to become fellows today. And we want to thank the CSEN of Babcock University Mission Hospital. We thank the PCN registrar, the PSN president, the in-country consultants of the Commonwealth Pharmacists Association, the Federal Ministry for Health, the LMI's partnership agencies, gentlemen of the press, the supervisors, the mentors, and every distinguished person. We look forward to having your support on this journey that we started to make change. And we pray that even as we go, the Lord will be with us and we'll get to our destination. Thank you so much.
Yes, yes. So thank you, everybody, everyone. We thank God for giving us the day. And I pray God will grant all of us journey blessings back to our station. To the 10 friends from Nigeria, please walk as a team. Someone have suggested publishing your work. Don't abandon your mentors. Work together. I hope I'm alive. I'm not doing your critics. Thank you. My president was not supposed to be here because of some schedule. But because of the love he has for you, I'm sincerely very grateful. I pray the officers spend up at the end of your hospital. We'll be talking of his re-engineer, for pharmacy profession that balance program. Thank you so much. We are grateful. Professor Charles, thank you. You tolerated me when I was getting trouble over the blood. But he got me to the right person. And I'm grateful. Dr. Taigwe, I'm very, very grateful. When I'm unable to get Professor Charles, I will hold him and I get my risk. In fact, I develop a strategy. Anytime I want to say something, I will talk to Professor Taigwe. Because I know it's to listen. So thank you. Our man from Jalingo, we are honored. We pray for his successful treatment. Please, announcement. Those who have training, transportation, health food and leading out, allow them to enter it into the association. Please, let me have the license so that I can pay. I'm supposed to render my account by Friday. So I need your full support. Thank you, God bless you. Photograph.
You don't end the stream.
This one is to one side, that's why. This one is not, it doesn't look good. It doesn't look good now. I know it's only wait, let's see how we'll go. But let me be done with this first. You let do so that it look beautiful. There's a crowd here. I'm not. I wanted us to. Please. Better. If possible, shift to one side so that we balance. Photography is an art. Do well. God bless you. Your wife will not run away. Okay. Really good.
No, I'm not in the picture.
Oh, yeah.
Started on the chair. Go and stand on the chair.
Just stay there now. I like doing things well. What is what is what me. Okay. Thank you for your patience. Okay. Yeah, nice. Hold on. We look good. Okay, we are set. Let's see it now. Beautiful.